Hey y'all, this is Marley K. Hope y'all are well. I'm gonna have two interesting stories today from Dr. McCullough's site on Substack. They're closely related, but I want you to listen to this one because I knew some of this from just working with the medical community when I worked in HIV/AIDS years ago, and also because my ex-husband worked in healthcare. So when a lot of hospitals were shifting over to electronic health record systems and they were doing all this stuff, and it was prior to President Obama coming into office, I learned about how doctors were incentivized by um, getting patients to answer certain questions. They prescribe stuff. Like there's this whole um, I hate to call it a scheme, but that's basically what it is. It's a whole scheme. In order for doctors to get paid, the insurance companies and sometimes the government requires doctors and healthcare facilities to engage in certain practices. And so that's how they maximize their money. And a lot of physicians don't like to deal with people who receive government insurance because the reimbursement rate for the care is so low. So they can get more money from people who self-pay, private pay, or people who have other insurance through employers or healthcare providers like Blue Cross Blue Shield, just for an example. And so the healthcare industry is not what you think it is, which is why, I try to really limit my interactions with going to physicians. Um, and I limit or I don't trust all the advice that they give because I know that a lot of times physicians are not up to date on the latest info when it comes to research, evidence based practices. Some things that they may have learned in medical school and over the years have changed. And they don't always go to um, different websites or do their own research to find out what's best for their patients. They kind of have this set regimen. They have whatever their beliefs are. Sometimes they're not into holistic medicine. They are paid by or given, I guess, incentives from drug makers, and so they'll prescribe those drugs. I just learned a lot of background information over the years, and so when the came out like in 2020, and then they came up with this solution, the lollipop, really quick. I was like, this is some bull swanky. But the push is what let me know there was something else behind it, especially directed towards African American people. You want anytime they want poor people to take something, you all better know something wrong because they don't never be trying to save our life. Never. So, I knew then there was something up. And then the reactions from the physicians, the way that the physicians were acting, they were all, I was in Florida at the time. So I would have some physicians that were on TV and they were like, I'm not giving this to my patients. I'm letting my patients decide. I'm not pushing it. I don't know what it is that, it's questionable. And I respected those physicians, but there were some that were getting on TV and in the African American community, we had a lot of raccoon class doctors, um, immigrants and African American Black doctors who were definitely afraid. A lot of them had been threatened, but a lot of them were incentivized. Like they received kickbacks or like additional payments for getting people to take the lollipop and to continue to give them those boosts and other things. that I can't talk about on this channel. So I'm going to not go down this rabbit hole. We have to talk about this maybe on Odyssey or Rumble. Or I'll upload that video on Odyssey and Rumble. And you'll have to go there to get that information. But I want to bring you this story because it ties into that, frame of reference where we really have to be careful when we go to doctors now. And what they tell us, they will tell us, whatever, not all. There are some good doctors out there. Don't get me wrong. And I always have loved physicians who will give you the diagnosis, then they give you the pharmaceutical recommendation, but I will also offer holistic um, options if you ask. Most times it's if you ask. But I've been to some physicians that will tell you, oh, you don't have to go to the doctor. You could do blah, blah, blah. All you have to do is go walk, get you some green tea. Da, da, da. So I like those types of um, doctors who will just, keep it real with you. The downside is that people don't like to listen to holistic options. People like the quick way. I'm gonna just take this pill and I keep eating this bad food and it'll make my blood pressure stay low. But over time, they don't realize that those blood pressure meds will ruin your kidneys and your liver. Then you have to go on dialysis. And then they, wonder why, oh, my kidneys are failing. I got to go get all these tests. So it's just like this vicious cycle. And so that's kind of what medicine has turned into in America. It's not preventative and it's not really helpful. It's about feeding the beast. I guess that's the best way to say it. Doctors have gone to school. They got their education. They want to make a certain amount of money. That's why they chose that field. It's not always about helping or saving people. And, the pharmaceutical industry, they have their goals and objectives. And the government has its goals and objectives. So everybody has a mission. And you, the sick person, you just go to the doctor and you just want to be healed, but you don't know the backstory of what goes on in medicine, which dictates sometimes the recommendations and the diagnoses that you receive. So I want you to read this. I mean, we're going to go through the story, but I want you to take into consideration each time that you go to a physician, especially if you are not a strong-willed person or you have strong convictions or you just understand what the game is. Just understand that this entire healthcare system has been hijacked, and you need to really, really, really be super cautious about what you put into your body going forward. So this story is from, again, Dr. McCullough, and it is this why pediatricians push lollipops. Not the lollipop, but lollipops. But this story is about the lollipop. And so he had to preface it this way in order to um, not get in trouble. Just put it like that. So, story at a glance. Primary care providers across the U.S. were bribed with incentive programs to coerce patients into taking the lollipop. I'm not going to use the language that they use in this piece because I don't want to be getting this video pulled or get a strike. So I will include a link to this in the description. Anthem Blue Cross and Blue Shield paid doctors $50 for each Medicaid, which is government insured patient, aged 6 months or older who got the lollipop. Doctors have been financially incentivized to stick children for a long time. In 2016, Blue Cross Blue Shield paid pediatricians a $400 bonus for each patient that completed 10 sticks before their second birthday, provided 63% of their patients were fully stuck. Client and family incentives also exist. In 2015, the Community Preventive Services Task Force recommended boosting sticks by giving small, inexpensive incentive rewards to patients. Bribery is also par for the course when it comes to the stick mandate. PZ paid undisclosed sums to front groups that advocated for lollipop mandates, thereby hiding their conflict of interest. While the furthered many them people's goals, inadvertently tanked children's stick rates. To get childhood stick rates back on track, a global alliance has launched, and it's called the Big Catch Up Initiative. It's touted as the largest childhood stick effort ever. In April 2023, Dr. McCullough reported how primary care providers across the U.S. were bribed with incentives to coerce patients into getting the lollipop. Since there was no medical malpractice liability, doctors profited while patients risked their lives as participants in an unprecedented medical experiment, all while being lied to about the safety and effectiveness of the sticks. Even more egregiously, once the Food and Drug Administration authorized the stick for children, similar stick incentives were extended to pediatricians as well, as detailed in an Anthem Blue Cross and Blue Shield Medicaid Provider Bulletin dated July 2022. Doctors received $50 for each Medicaid patient aged 6 months and older who got the stick. Pediatricians are financially incentivized to stick. As it turns out, doctors have been financially incentivized to stick children for a long time. According to a 1999 JAMA Pediatrics article, and JAMA is the Journal of American Medical Association or something like that. The average patient load of American pediatricians is 1,546. That means that's how many patients an average pediatrician carries in their practice, or just, their caseload, like a social worker. Although the number of patients was significantly higher in less populated areas and solo practices, which is true. So, I live in a rural area now, so there are not that many pediatricians. And so everybody that has babies or young children tend to have the same pediatrician. My ex-husband worked for a family medicine residency, so they saw the entire family. So, your doctor could see your entire family, and that doctor would see adults and children, and they could have far more than 1,500 patients because they served 7 counties. So that's a lot of money to be made if hospitals or practices or individual physicians are seeing such a patient load and being able to be reimbursed or incentivized to get people to get stuck. And parents don't know the difference because they think that, oh, I'm going to the doctor and the doctor's recommending this and I need this. And sometimes things are required. Your kids can't go to school if they don't have these things. And so, people go to the doctor and get their kids stuck. Or you can't go to work if you don't have this. So there are a lot of things that are beyond our control, but I just want to share this story with you so that you understand that everything isn't what it looks like. Of these, 8.3% were younger than 1 year, 9.5% were 1 year, and 8.6% were 2 years old. That means approximately 26.4% of the average pediatrician's patients were 2 years old or younger. More recent data published in 2021 shows 75% of pediatricians have between 1,000 and 1,800 patients, and 21% have around 1,200 patients. Most practices, 65%, are in the 1,000 to 1,500 range. So I want to get down to the money part. While $400 per fully stuck child might seem incentivizing enough, there's an added pressure here because Blue Cross Blue Shield also has, or at least had in 2016, a target level of 63%. So that means they wanted to have at least 63% of children in this country stuck. Children that were that were covered by them. And so that means that they probably also received some type of incentive from someplace else too. Otherwise, why would they be incentivizing the people giving the sticks? This means that if the pediatrician fails to vaccinate 63% of his eligible patients, he or she gets nothing. So the pediatrician has a very high incentive to get as many toddlers fully stuck as possible so as not to miss the target. And then it's not just the $400 that is at stake when patients decline one or more sticks. Tens of thousands of dollars could be on the line, as noted by Dr. Bob Sears. Such incentives end up forcing a doctor to consider the financial implications of accepting patients who even just want to opt out of one stick. Maybe a few such families would make them fail the chart reviews, but if they have too many, there goes their year-end bonus. And so when they switched to these electronic health record systems years ago, and again, this was prior to President Obama coming into office, and I remember it so good because my ex-husband stayed at work a lot training for to learn how to use these things, the whole hospital system, and his practice had switched to these electronic health record systems. And so he had to learn, so he had to go off, he had to come back and do more, a lot of in classroom on site training. And then he had to train other people because he was a trainer. So they did like this train the trainer program. But he was really, he had to also train the doctors. He was a nurse and practice manager, but he also had to train the doctors because doctors, didn't feel like that was their job to do all this stuff. They used to be able to just dictate to the nurse, and the nurse would write all the stuff up and he'd just sign off on it. Well, once they got the electronic health record systems, doctors had computers in the office, and so they had to, every time they saw a patient, they had to check off boxes, and the system was set up to ask certain questions and, you know, encourage the dialogue and offer patients things and ask patients things and suggest stuff. So that's what all this electronic health record stuff was all about. Back then, I didn't realize that. But when Obamacare came on board and I saw how doctors, I was in Florida, so part of the rejection of Obamacare was it came from a black man. Two, the doctors were pissed because a lot of independent practices, doctors who have been in office, I'm sorry, not office, have been in business for a long time, were required to upgrade to electronic health record systems, which a lot of them was like, I'm not doing that. So they stopped taking patients who got any type of government insurance, because the government required that they had an electronic health record system and follow what they're talking about in this piece, but not just for children, for everybody. So you had to make recommendations, but not only that, you would be penalized and sometimes not paid for non-compliant patients. So say if you had high blood pressure and the doctor prescribed you medication and you didn't go get them the pills when they prescribed them, or you refused, but you kept coming back because you start having issues as a result of not doing anything about your blood pressure, then the doctor wouldn't get compensated if you got Medicaid or Medicare or some other type of insurance, or even these other insurance companies. They could just be like, okay, you have a non-compliant patient, so we're not going to pay you. So it was a way for insurance companies and the government to get out of paying doctors for non-compliant people for which they had no control. So these doctors started not accepting insurance, and that's one of the reasons a lot of doctors opted out of accepting Medicaid, Medicare, and these other types of health insurance, state health insurance plans, because one, they pay low. Two, you had to do a whole bunch of stuff to get that little bit of money. They had to upgrade their systems when a lot of people just use paper charts, and they were content with that, which I don't have no issue with it either, because again, you can control what's in your office, but you can't control data once you put it into a database and it's stored someplace. And three, you can't control non-compliant patients. And I hate to say this, but sometimes poor people are the worst patients. Like, they just ain't gonna do it. And just knowing the black people that I know in my circle who take drugs, like my father, and other people that I know who have health issues, like, it doesn't matter what you tell them, they just ain't gonna do right. My dad is a diabetic, but he eats lots of things that he shouldn't eat. And then he goes to the doctor and whine when they tell him, well, if you don't stop doing this, you're going to have to go on dialysis. Been a diabetic forever. Not forever, but it was self-induced from eating poorly, drinking alcohol, not taking care of himself, not resting. And so he loves to go to the doctor, but he's not compliant. So it's defeating. But the doctor is not getting paid because he's not compliant, and that's not fair to the doctor. So and my dad isn't poor, by the way, but that's just an example of non-compliance. But on the flip side, you have poor people who just ain't gonna do right. They'll go, to the doctor because they got high blood pressure, they did a blood pressure check at work. They send them to the hospital or the urgent care, whatever. They go, they get blood pressure meds, they get the blood pressure down. They don't take the medicine no more. They don't stop eating. They don't do anything to change their lifestyle. And so they keep having issues, but they keep being non-compliant. So those doctors don't get compensated. And so they end up kicking those patients out of their practices. So what happens is those people end up not getting care. So it's a whole art behind medicine. I don't really want to get into it on here, but I just want to explain that to y'all. But the gist of this is, understand that when you go to the doctor, they have these electronic health record systems, and they are encouraged to get you to do things that you may not need because they get a financial incentive. So the incentivization of healthcare is here, and what your physician may be offering you may not be best for you, and what your physician may be offering you may not have anything to do with you at all. It may have something to do with the bonus that they're looking for, or some award or something else. So just be careful when you go to doctors now moving forward, because They moving real greasy out here. The Most High gave us discernment, so y'all need to be using it. And with all things, even me, you don't have to trust me. Please don't trust me. Do your own research. But when you go to these people who are supposed to be professionals and who are in areas that are supposed to uh, facilitate our well-being, emotional and physical, you need to have discernment, because a lot of times, if you don't know what's going on the other side of the system, you could be taken for a ride and it may not be good for your health. All right, please like this video, share it, and subscribe to the channel. Also subscribe to my Odyssey and Rumble channels in the event this channel is taken down, preferably Odyssey, because Rumble, for whatever reason, is not uploading all of my content from YouTube. And consider subscribing to my Substack and my social media pages, Instagram and on Facebook, Marleyisms. Also, if you like this type of content, consider uh, subscribing to the channel and also supporting the channel financially, because we find these stories and we bring them to you as a labor of love. We do not get compensated, and we are not affiliates of anything, and we don't affiliate with anyone. So again, keep praying, keep prepping, use your spiritual discernment, read more, don't let raccoons intimidate you, and bless everything that you put inside of your body, because at the end of the day, we need a higher source protecting us. We can do all the discerning we want, but even the food that we're eating is bad now. So we just got to pray over everything that we put into our bodies, and ask the Most High to look over us as we walk through this darkness, y'all. All right, this is Marley K, and I am out.